Hey, how are you doing?
Doing well. How are you?
Doing good. My name's Tyler. I'm going to be the nurse that's doing your vascular assessment today.
Okay.
Can you tell me your name and date of birth, please?
Kyle Turner, 7/3/1991.
Okay. Before we get started, I just want to perform hand hygiene. And do you have any questions for me before we get started?
I don't believe so.
Okay. Before I perform the exam, there are a few questions I want to ask you, okay?
Okay.
Are you having any pain today?
No, not today.
Okay. And on a regular day, do you notice any swelling in your lower extremities?
Typically, no. I have some swelling that happens from an old injury in my left knee occasionally.
Okay. And what causes that swelling?
Usually overuse. I had a ACL tear in this left knee, and now like if I do overuse, like exercise, long walks, anything like that, a lot of stairs, then I'll just be swelling there.
Okay. And was that surgically repaired?
It was. I had a reconstruction on that side.
Okay. And since your surgery, have you noticed any any skin, like the temperature changes in your skin? Like, is this leg cooler than your right leg?
I haven't noticed anything like that.
And no redness or anything like that?
No.
Okay. Any other surgeries?
One other, I had a surgery on my forearm on my left side. It's been a while since that surgery, but I had that also repaired, so I have plate and screws on that side.
Okay. And then again, same questions. No changes in the temperature of your skin or anything like that?
No, I don't think so.
Okay. And whenever your knee is flared, what do you do to alleviate that pain?
Typically, I'll just do like some resting, maybe some elevation.
Okay. With ice?
Sometimes,
Ice?
if the swelling's bad enough, I'll usually do some ice as well.
Okay. But on a daily basis, it doesn't limit you from walking or
No,
on a daily
typically I
basis?
can do all those.
Okay. Do you have any medical history, such as like diabetes, high blood pressure?
No, I don't.
No. Okay. Any family history of high blood pressure, diabetes, heart attack, or stroke?
Not that I'm aware of.
Okay. What about congestive heart failure?
No.
Okay. Do you take any medications daily?
I do not.
Okay. And do you use tobacco products, cigarettes, dip, or smokeless tobacco?
No, I don't.
No? Okay. All right. So we're going to get started. Before we get started, any questions?
Don't think so.
Okay. So the first thing I'm going to do is have you hold your hands out. What I'm looking for here is just assessing your skin color, which is appropriate for your ethnicity. Next, I'm just going to do a visual inspection, looking for any scars, open wound, lesions, anything like that. The only thing, obviously, that's noted here is your surgery scar. I don't notice any scarring in your elbows or anything like that. Next, I'm going to check the cap refill in your fingers. So what I'm going to do is just apply slight pressure to your nail beds of each finger. And what I'm doing here is just looking to see how long it takes for the blood flow to return back into your fingers.
Okay.
Less than 2 seconds is normal, which is what the cap refill was in that hand. Again, same thing. Slight pressure to each finger, assessing how long it takes for blood flow to return. Again, all of your cap refill in this hand is less than 2 seconds as well. Next, I'm going to look at your nail beds to look for any cyanosis, which is like any bluing of your nail beds or paleness, anything like that. They're all pink, which is normal. Next, I'm going to look at the side view for any clubbing of your fingertips. Clubbing is caused by poor perfusion or poor oxygenation. Okay. All right. So there's no clubbing noted in either hand. Next, I'm going to assess the temperature of your skin from your upper arm down to your fingertips by using the back of my hand. Doing this at the same time to make sure that the temperature is even all the way down. Okay. Next, I'm going to assess the pulses. I'm going to start down at your wrist. So if you don't mind, could you take your watch off,
Sure.
please? So I'm going to start at your radial pulses. To find the radial pulse, you'll put, with your first 2 fingers, just slight pressure right above the wrist. And you're going to check this at the same time to make sure the pulses are symmetrical. Your pulses are 2+, which means they are normal, and it's a regular rate and rhythm. Next, I'm going to assess the brachial pulses. Again, to find the pulses with your first two fingers, apply slight pressure right below the bicep or above the elbow. You want to check this at the same time to make sure they're symmetrical and have regular rate and rhythm. And your pulses there are 2+ as well. So for the next part of the exam, I'm going to assess the blood flow and your lower extremities. So basically it's the same thing that we did at the top, just doing it on your legs, okay? So if you don't mind, just having a lay back on the bed for me, and if you could pull your socks off whenever you're comfortable.
Sure.
So the first thing I'm going to look for is I'm going to assess the hair distribution in your legs to make sure that it's even and that there's not any hair loss, which could indicate vascular disease. Okay. Okay. Hair looks good. There's no patches and there's no baldness noted. I don't see any obvious wounds or anything like that. Next, I'm going to assess for varicose veins, which is just the bulging veins that are typically at the back of the leg. Have you ever had any issues with varicose veins before?
I haven't.
Okay. So I did not notice any varicose veins. Next, I'm going to assess the pulses. So I'm going to assess your popliteal pulse. To find that, you're going to take your first two fingers and apply slight pressure right below your kneecap. Again, we're checking this at the same time to make sure that the rate and rhythm are equal. Okay. You have regular rate and rhythm and your pulses are 2+. Alright, next I'm going to assess the pulses down in your feet, okay? So to check here, just going to apply slight pressure right between the tendon and your ankle with your first two fingers. So you want to do this at the same time to make sure that the rate is regular and symmetrical. All right, your pulses are 2+ there as well. Next, I'm going to assess the pulses in your dorsalis pedis, which is just the top of your foot here. To find this pulse, typically you can go right between the your first and second toe, or right on the other side of that bone. To do that, just apply slight pressure. Check at the same time to make sure that that they are equal and regular, and your pulses are 2+ there as well. Now I'm going to check cap refill in your toes. Again, the same way that I did with your fingers. I'm going to take and apply slight pressure to the nail bed on each toe. And as I'm doing this, I'm checking to see how long it takes the blood flow to return into your toe. Okay. So the cap refill in your toes are less than 2 seconds as well. Next, I'm going to look at your nail beds to make sure there's no cyanosis noted. Your nail beds are pink, which is normal as well. Next, I'm going to check the warmth or your skin temperature by using the back of my hands, starting at the top of your leg. I'm going to work my way down at the same time. Done with the back of my hands. We're going to go all the way down to the tips of your toes. And your skin is warm throughout. There's no changes there. And then I'm going to just assess for any swelling in your legs, okay? So to do that, I'm just going to apply slight pressure to the top of your legs here, and then the tops of your feet as well. All right. Do you have any questions for me?
No, I don't think so.